Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from the Moses Lake Professional Pharmacy podcast studio. And we are super excited to have Dr. David Rosensweet on our podcast today. And we will be discussing bioidentical hormones and how he has trained providers all over the nation for hormones. So, Dr. Rosensweet, welcome to our show.
Shawn and Janet, good to be here with you.
You as well.
Awesome. So tell us a little bit about your history.
I knew I was going to be a doctor when I was 12. I just got it. And I went to medical school at the University of Michigan. I loved it in the 1960s. And when I graduated, I started looking for tools from old timers. You know, what were they doing? Did they have any pearls, any tricks? And I eventually developed into what is now functional medicine. And along the way, in 93, one of my patients in Santa Fe burst into my office before hours one day. I knew her really well. She was in her mid-40s. Walked up to my desk and slammed her fist on my desk and said, "I want to tell you something. I'm going crazy. And I want you to help me. I don't want you to pretend that I'm just fine like you know me to be." I was really shocked because she was a brilliant woman who had been so successful. She retired in her 40s. Stop and think about that one for a minute.
Yeah.
And I had been speaking to John Lee. Just serendipitously, if that's how life works, I think it's more to it than that. And I gave her some progesterone, and as you know so well, the results were so dramatic. Within 3 weeks, I got a letter from her saying, "I can't believe this stuff. I'm totally myself again. Thank you so much." I wasn't used to things being that dramatically successful. By the time someone consults a physician, it can be a slow-moving train. But I wasn't really in control. She referred some of her friends, and before I knew it, I was in the hormone world.
Right.
And I loved it. I met my first compounding pharmacist in 1992. I really enjoyed him. He was very, very knowledgeable. Learned a lot from him. There wasn't much known back then. And off we went. And the results were so dramatic that it was very easy for me to shift gears, narrow my attention down to treating women and men. That's what I did. I couldn't keep my arms around all of functional medicine anymore. The knowledge base was too big. I wanted to zero in on something, and I've been doing that for 30 years, loving it.
That sounds like a familiar story, huh, Janet?
It does. In fact, your timeline's actually uncanny. So, yeah.
So, Janet, what kind of questions do you have for Dr. Rosensweet?
Well, so we all have a journey with this person, and I'm assuming that was the start. But kind of give me one of the most dramatic cases that you've had. So, I mean, you kind of talked a little bit about how she thought she was going crazy, but we all have stories of couples or something that is just inspiring to keep you going. So give us a little flavor of that.
Well, the hormones are the most powerful biochemicals in our body. And as they diminish, which they do in all of us, men and women, where they were at our peak in our 20s and they never stop declining. As we lose these hormones, the outcome is very, very strong. Like, for example, 80% of women experience symptoms so disruptive that it's a game stopper for them. They lose cognitive function. They lose sleep. Anyone lost 3 nights of sleep lately? How's that go for you?
Right.
Wake up in the middle of the night with hot flashes, can't go back to sleep, vaginal dryness, pain on intercourse. The list goes on and on and on. And so the symptoms for 80% are so dramatic that I think it's a beautiful thing because it inspires the woman to seek help and to really solve it, because there isn't a way around it. And so by the time patients show up in my office, they're really motivated. They're hurting. And then it's, if they're basically healthy, as so many are, The reversal is pretty much a slam dunk. It can take some time. It can take 3 months, 6 months, 9 months, a year to replenish the hormones carefully, individualizing them. And you, as compounding pharmacist, this has always been the key. I can write a prescription to a compounding pharmacist to individualize it for that particular woman or man. So critical. And so, it's almost patient after patient after patient is dramatic, which is extremely rewarding, because when they get their life back, they're back out there in the streets doing their good thing, and they're grateful. And that's the most beautiful thing I can ever hear from someone is, oh my God, I feel myself again. So it's very inspiring. And then, we want to change the world. Our particular mission happens to be, we feel like the world desperately needs more feminine energy in the halls of families, business, politics, everywhere, to save it. And so
Absolutely.
the team we got a wonderful team. They're mission bound. That's what attracted them to us. And so it's that big, and to empower men, so they can be more conscious and be more, and the symptoms are very dramatic for men too. We didn't know there were symptoms in men until Viagra hit the streets.
Right.
Yeah.
Then we learned, oh my God, there's men having erectile dysfunction. Please pardon my stubble. I had 5 days to grow out a beginning of a beard again, but it looks pretty hokey today.
You're
Good
fine.
for you.
Well,
I'm not very good at growing a beard, so.
Well, I have to share that I think Shawn and I agree that, one of the most rewarding parts about helping our patients is that it is something that they appreciate. And when you have a woman say to you, I love my husband like I've never loved him before, and he deserved better, and I wasn't giving it to him. And in the fine way of saying, we weren't communicating. I didn't want him by me. I didn't want anybody in my family to be next to me, and that's not who I am. To come and say those things to you and express their gratitude of where they are now, and like you said, they're out there, they're working, they're loving their jobs, they're loving their neighbors, their friends. I mean, it is just game changing for them, as well as their surrounding people that they care for. And that does make a better place for everybody to live in. I mean, certainly. I mean, and to have staff that wants to be a part of it, that's something Shawn and I have celebrated, that when we have staff that understands how this impacts everybody around them and themselves, and it's a beautiful thing.
Well, I can say that you said it earlier, Dr. Rosensweet, how rewarding it is. One of the comparisons I like to use is, when you're practicing traditional medicine, or when we were practicing traditional pharmacy, dispensing blood pressure medications and cholesterol medications to people, I can't ever remember a time where somebody said, thank you, Shawn, for
Right.
help me with my blood pressure or
Sure.
or lowering my cholesterol. I mean, right?
Right.
And yet almost daily we get responses from patients saying how we've changed their life and, changed their marriage. And, my husband and I were going to get divorced, and now we're married, happily married again. And, and some of even the cooler ones, they're all cool. Like you said, they're all dramatic cases, but when you see a husband and a wife in their 70s and they're having the best sex of their life, and they tell you that is really, really rewarding.
Boy, do I know that one.
Yeah, right. We hear it all the time, right?
Yeah.
And you wonder, Dr. Rosensweet, well, we don't wonder, we know, but in the traditional the traditional healthcare system where most doctors are just practicing sick care type medicine, they don't see that at all. In fact, most of those doctors will tell patients when they go to their office, oh, well, you're in your 50s now. Sex isn't as important anymore. You're just going to have to get used to it. Right? I mean, we've heard that all the time from doctors that,
Yeah.
and the patients then seek us out and find alternatives.
Yeah, they don't know what they don't know. If it's because this is, as long as it's been around, it's still just emerging to the general public in certain ways. And the physician population seems to be one of the slower moving trains. Bless their hearts, they're on the front lines. I know what that's like. But they don't know because we were never taught this.
Right.
And maybe in their own life, they've resigned to the losses themselves and, want to get strong and live it on out. But then again, there's a lot of physicians and nurse practitioners who are just racing after this because they see what happens. And that's the beauty of it all. It's moving very fast.
So speaking of training, physicians aren't trained. One of the things that you do now is you train healthcare professionals to learn about bioidentical hormones, correct?
Yeah, we for the last 15 years, I've really devoted the majority of my professional efforts to develop training programs that are online, that are very, very thorough, and also very Monday morning focused. So they do what I always looked for in seminars. I went, boy, I love the information, but man, I got a Monday morning to show up for.
Right. That's true.
So we do both, and we do weekly grand rounds. The medical model has been invented long ago. The wheel is out there, and it's train people and be there for them to deal with their challenging cases, because we all learn it patient by patient. I mean, we've already got all the prep work we need. And so that's what I do. I love doing it. It's fun. They're good. And these are the most interested of the providers. They're the most curious, most seeking out, how can I do good stuff here? And so that's what I get to do, is spend time with these folks, a lot of them.
And so is there a website, or what's the best way for people to find out about these training seminars?
IOB as in boy, IOBIM.org. That's the training. And then the other part that we did is about 12 years ago, about 15 years ago, I had been treating women for 10 years. I had never seen a hormone. I was just sending a prescription to my local compounding pharmacy. He was a pharmacist. He was in Albuquerque, and I was in Santa Fe, and he would ship them to my patients. And then one day he misshipped something. Yeah, that's it.
Tell us a little bit about your website, and then we'll get back to the misshipping story.
Yeah, well, this is where providers could go to really enter in the world of training, mentoring, and we've developed an amazing amount of technology to facilitate the process. I have the team has put together something that is what it really supports is excellent medicine, and it's every step of the way. So we have provider portals, questionnaires. We have ways of transmitting prescriptions to pharmacists, and we've got a network of compounding pharmacies. And a lot of tools, a lot of information. We have a medical board. This website will tell people all about it. And
then does this website have a link to the providers that have been trained if they want to find a provider?
We have someone who is on our team who has that full list. For women and men, the place to go is Brite, BRITE .org, I think. BRITE.
Our producers.
This is where patients will go. And this is about how to contact compounding pharmacists who are dispensing in our organic oils. And that's what the story I was going into is, about 15 years ago, one of my patients' bias prescription shows up in my office. It was an error in shipment, and I was fascinated because I had never seen the hormone.
I see. Okay.
And it was in those white cosmetic jars. Remember the day?
Mm-hmm.
Yeah.
I do.
And there was the little two-sided spoons. One was an eighth of a teaspoon, and the other was a quarter of a teaspoon. That's how we did it.
Yeah. Yeah.
And I was fascinated, and I broke the seal. And I opened up the jar and I smelled something very strong. And I did a lot of research on it because I'd always been a functional medicine doctor. And I realized that some of the carriers had toxic potential. And I did the math, and I'm realizing I'm asking my women patients to put on about a quart a year that's a strong solvent. Because as you know, to get these things up in the solution for uniform dosage, you have to use a solvent because the steroid hormones are poorly soluble. So we went on to do a couple of years of research into optional ways to do it, and eventually came up with and have patented very extensively an organic oils delivery system. So they're a suspension. They're not a solution.
Mm-hmm.
And it's in a certified organic oil base. And that's what Brite is about. And Brite is the place where patients can contact us.
Awesome.
You know what? It might be Brite.Live. Excuse me. Not too well.
We couldn't find it under Brite, so we're looking it up now. And your assistant probably sent me the link, and I wasn't very good about it. There it is right there.
Yep. That's the one. So
Brite.Live, right?
Yes.
Yeah, we've got an awesome producer that can find that stuff fast. So
all right, that's great.
So we're gonna go ahead and stream that, and you can tell us a little bit about it.
So that's a major project we have doing. We've done a lot of research, and I'm also co-chair of the Coalition to Protect Compounded Bioidentical Hormones. The CEO of the APC, perhaps you know him, Scott Bruner, and I are co-chair. Yeah, that's it. This is where patients would go if they want to find someone we've trained.
Awesome.
Yeah,
I'm very familiar. And that fight, as you know, Jan and I have been fighting it for 25 plus years now. And basically it's against the FDA and Big Pharma who want to stop compounding. And every time we keep thinking the fight is over because we win something, a big case or whatever, they bring up something else. So the fight's never going to be over. And I think it's frustrating that, the frustrating part is that Big Pharma, they own 99% of all the drug market, and compounding pharmacists own maybe 1% of it. Yet that's not enough, or that's too much for them. So they try to go after us. So
I know it very well.
Yeah. So the fight will never be over. That's for sure.
Well, they're a minor obstacle.
It's true.
Well, here's one of the and here's one of the things is our patient stories are what's important.
Yeah.
Because when we have good results like we have with our patients and great stories and great outcomes, it's really hard to stop it because patients just won't accept that.
And that's what we're working towards. And there, as you know, there's also an army of patients rising. And tomorrow, just last week, I got on a call with a lobbyist for a certain huge women's organization that's got 500,000 members in it. And I've been treating their leader, and she wanted to reach out and protect. And so we got lobbyists from the APC linking up with these lobbyists. So there is another side to it.
Yeah,
as you know, because you've been in the trenches.
And you have a group of 500,000 women that start lobbying to not take their hormones away. That's going to be pretty big.
Yeah. So it's nip and tuck.
So Dr. Rosensweet, tell us about what you have a passion for. What do you have a passion for?
My own personal growth.
It's well said.
Yeah.
And my partner, my beloved Zoe, my family, my son, daughter-in-law, just getting present and being alive, which is a process, as you know so well. And the more I show up, the more dramatically fascinating everything is, including being on this call with you. I mean, I recognize the two of you the moment, even though we've never met. I said, "Oh yes, here we are."
I love it. So a lot of times a doctor's journey when they go into prescribing bioidentical hormones or going into functional medicine in general, a lot of times their journey started personally with their own health. Is that true of your case?
My journey, right out of the gate, as soon as I graduated in 1968, I loved my training. I love medical school. It was like going to church or synagogue for me. And I thought it was very holy. It was very sacred. But I thought that I needed more. And so I started seeking out some of these names that are long gone now, people who are interested in health and in healing. And I met up, so I had the great honor and privilege of meeting up with some of the pioneers in functional medicine. And that's always been a thrill.
Yeah.
And then here we are, we're in the same arena, we're in the same tribe, really. And the care and devotion that people have. And so I've had what else is my passion is the unfolding of life is in my own professional life, because it's just unfolded. It just like Deborah was storming into my office.
Right.
I didn't plan that.
Right.
Yet she changed the trajectory of my whole career.
Right.
And so medicine is like it is in you. I just sense it. It's so deep in our bones. So, and it's exciting. I mean, I love medical school, but it's quite a bit more exciting now. And so I sort of lost track of the question, like, what am I passionate about?
That's all right. No, I like it.
What is really cool to Shawn and I is to actually witness this, because, you see people in the profession who've lost that, right? That they're either a shell of the person they were when they first started practicing, and to see the joy of actually living out the healing in other people is an art, and it's beautiful, and it's something that we really are striving for when we start our journey in healthcare, and very few seem to find it. I think there's more out there, but we totally understand.
Now I'm recalling where it really started for me. Do you want to? Should I?
Please share. Yes.
It was at my University of Michigan Medical School graduation. There was over 200 students, and we're in front of 2,000, an audience of our parents and relatives and distant relatives and friends. And they're passing out the diplomas. And the main dean, because there were so many of us, the main dean is lecturing to the audience. And the assistant dean, beautiful men, just beautiful people, is calling out the name, mixed in, they orchestrated with the main dean lecturing. And I was an R, so I came in quite later, and he calls out my name, and I walk up the podium to reach out and receive my diploma, and out of the main dean's mouth comes, "And physician, heal thyself." And instead of taking my diploma, I started falling to the ground. I started to faint. And I caught myself near the ground and had the youthful strength to be able to stand back up. But I was in a state of minor shock, and I took the diploma and walked back towards the group. But I walked down an aisle and out of the main auditorium, and I was in a total body sweat. And I'm leaning up against a pillar and saying to myself, "Oh my God, what did he mean? Physician, heal thyself. We haven't learned anything about healing." And oh my God, I'm afraid I'm going to have to be one of those.
And now you are.
And that turned out to be true. So what really launched me wasn't so much my physical journey. I've been very blessed with a strong physical constitution, but it was emotional consciousness, life, living. That's where I put in the work. So,
wow, that's powerful.
Yeah.
So as we wind this podcast up, Dr. Rosensweet, what is the best way, if anybody has any questions or wants more information, to get a hold of you?
Well, through that, if it's a patient, through that Brite website, Brite.Live, and if it's a healthcare professional, through iobim.org. There's ways that we can connect up personally, especially with professionals. My
Awesome.
team, we know how to do it. We know how to do the link, and we'll walk it out together.
Yeah, I love it. So what are your parting words before we sign off today?
I don't know. I'd say what comes to me in the moment is it's a pleasure to meet the two of you. I know a lot about you, even though I've never met you, as you know about me.
Mm-hmm.
And I'm just grateful we get to do this together.
Awesome.
And it's very reassuring that there's so many good people involved in this great work. And it's our contribution. Yes, people have their homework to do on every level and take charge of their own health and healing. And there's a place for experts. And I highly advise experts. We're devoted to making people expert at this. And I recognize the two of you, and I'm grateful for all of us and the gift we've been given to be able to do this together.
Well, thank you for that. And thank you for connecting with us. And you talked about people being in charge of their own health. The goal of our podcast is to educate and empower individuals to take charge of their own health. And as experts, us and you, that is something that we take very seriously. And ultimately, that's our goal, is to educate and empower. So thank you, Dr. Rosensweet. You've helped us realize our goal today on our podcast.
Thank you very much.
And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Thursday to our midweek podcast scheduled 8 a.m. to 9 a.m. Pacific Standard Time. Health Solutions with Shawn and Janet Needham. Thank you.